Welcome to the HealthCast, where we explore the intersection of healthcare, technology, and business innovation. I'm Phil Zappone, family nurse practitioner and founder of NXAI Growth Consultancy. We help healthcare companies grow with AI and automation. On this show, I speak with founders, clinicians, and innovators who are building the future of healthcare. Welcome to another episode of the HealthCast. I'm super excited to have Dr. Lorie Poston on today. Lorie is a dual board-certified nurse practitioner specializing in family medicine and adult gerontology acute care. She brings over a decade of experience in multiple specialties. She previously served as chief practitioner for the Department of Medicine at a transplant center, leading the inpatient service. She's also the founder of Telehealth Care Florida, where she focuses on delivering accessible, patient-centered care across multiple states. In addition to her clinical work, Lorie is building Lana U, a lifestyle brand rooted in intentional living, mindfulness, and simplicity. Her work sits at the intersection of healthcare, technology, and the individual experience with a focus on living with purpose. Welcome, Lorie.
Hey, Phil. Thank you so much. Thanks for having me.
Of course. Thanks for joining us. Okay, let's dive right into it. Let's start with your career background. You've had over a decade of experience in inpatient care, outpatient, and leadership roles. What initially drew you into healthcare, and how did that evolve into telehealth?
Yeah, I get asked that a lot. So I've had the opportunity to care for people across various environments, both nationally, internationally, and from high acuity hospital settings to telehealth. And this gave me a unique perspective on both the strengths and gaps in our system. Over time, I became increasingly interested, not just in delivering care, but in how the care is designed. Telehealth is a powerful community resource, and I've intentionally used it to reach those who need it most and to give back. One small example of this would be during natural disasters like the hurricanes in Florida. I was able to offer visits free of charge to individuals who may have needed a medication refill because they lost theirs or they couldn't get to their regular provider during those times.
You've had a variety of roles, including ICU, hospitalist medicine, and leadership roles. What gaps in healthcare do you repeatedly see?
As healthcare evolves, what I see is gaps in design. Patient care was not meant to happen in 15-minute visit increments. It was meant to happen where patients are. And I think meeting them where they are psychologically and physically is so important. And I think design is where our focus needs to be in this coming decade. Yeah, so when I was staffing in clinics, I started to notice that patients had access to as much diagnostic technology and sometimes more than what I had in the office for them. I mean, now patients have access to Cardia Mobile to pick up arrhythmias like atrial fibrillation. And we've also got wearables that are FDA cleared, pulse oximetry, glucose, heart rhythm, heart rate, blood pressure, all these things that we didn't have. And so I was getting as good of information from patients, sometimes more or better information because they're really vested in their care and giving me those logs. That's data that I can really use to help them. So that was eye-opening for me. It surprises a lot of people when I say, I wasn't an early believer in telehealth. I had to come around to it. And now that I see what opportunity there is to meet patients where they are and how many things can be triaged and managed, it's totally changed my outlook.
How does your personal mission, helping individuals be their best, be their healthiest, connect to your career decisions? I try to uncover where people have a personal mission and the work they do and where those overlap.
Yeah, no, that's a really important question. I think, one thing that we don't talk about enough in healthcare is with the evolution of technology, I do try to be really mindful, and I hope others will too, is that we're transferring a lot of responsibility from our healthcare systems to the individual because care has been decentralized and it can be more episodic. And I think it needs to be more continuous with telehealth, with wearables, with remote monitoring. Patients are going to be asked to take on a much more active role in managing their health. And I think technology does enable it, but I think that we haven't addressed what it means in terms of education, support, and accountability. And that's where I try to focus my time and attention to be well positioned to help patients where they are in this healthcare system.
What did you want to do differently from traditional healthcare models when launching your practice?
What did I want to do differently? I wanted to get back to when we had more time with our patients. And I know, yeah, we all say that, but telehealth for me really does that because there's no middleman. Technology allows the patient to self-schedule. They complete, what they want me to know prior to the visit. Some send me a lot more information than others, but I'm the first one to connect with them. There isn't a nurse or a medical assistant in between. I get that information firsthand. I get the whole visit duration with them. We focus on what they need to focus on, and we set the stage for the next visit. To me, that's been priceless.
I am uncomfortable when I have to, what I call it fast food medicine, when I have to practice like that. I just don't feel like that's how I want to, it's not how I would want to be treated as a patient, and it's not how I want to treat my patients. And sometimes I find myself in that position where I'm just crunched. And that's awesome that your business provides an alternative option.
Thank you.
For our listeners unfamiliar, how would you describe Telehealth Care Florida and the core problem it solves?
I think there's a lot more awareness because of the state of our healthcare system and health insurances. And so, what my practice solves is I see a lot of folks who have no insurance, have high deductible health plans, or maybe they're a traveler, like they spend half of their year here, half of their year in Canada or somewhere else. And so they're looking for easily accessible, affordable care that doesn't have to go through insurance. And there's no surprise billing or surprise fees. And they're getting that direct communication with the provider. It's clear, it's easy to navigate, and there's that peace of mind, again, that there's not sort of the surprise billing. And that has given me really nice results from patients.
Your model is simple and transparent with flat pricing, no insurance. What led you to that approach?
Seeing the breakdowns in healthcare and seeing how it prevents individuals from accessing the care that they need.
Accessibility is a key theme. What does accessible care actually look like in practice for your patients?
I think accessible care means ease of care. I was really mindful in shopping for an electronic health system where the patient could self-schedule, where they could see their chart, see their medications, easily upload information to me that I needed, easily connect to the telehealth visit. They don't have to download sort of another system to connect. It's very limited clicks and user-friendly. I have patients who are 18. I have patients who are 94. So,
What I
even
hear
if
from that
it's
is
not,
easy to use.
yeah, it's so critical because, even if it's not for everybody, for those who are interested and comfortable with it, making it user-friendly makes all the difference and invites more people who maybe are curious but aren't sure if they can tackle it.
What types of patients or conditions are best suited for your telehealth model?
That's a good one. So I'm very quick to tell someone when I don't think that telehealth is the right modality for them. And if they need in-person care, or they need to go to the hospital or have a procedure, there certainly are limitations that I don't think will ever bridge with telehealth. I would say most folks recognize that when they come to me, whether it's a simple sinus infection or they're monitoring their blood pressure at home with their biceps cuff and they're giving me that log and we're refilling their blood pressure pills, or we're refilling inhalers for asthma that's controlled, things like this. I've certainly had visits for things that I can't help, right? Like chest pain or like stroke symptoms. But just because I can't cure something over the video screen doesn't mean there can't be a positive impact. Sometimes folks need that objective opinion to say, here's what I'm seeing, here's what the concerns are. I want to be transparent with you about them, even though they might sound scary. And here's the next steps that I really think you need to take. And that's been really helpful too.
Yeah, that's great. Telehealth surged during COVID. What has changed since, and where are you seeing friction now?
Friction is in the same things. I think this really goes back to design, needs to be what we focus on in the next decade. Our systems in the US still don't talk to each other. I cannot access records from the hospitals or diagnostic centers and such, and vice versa. So I'm hopeful that with the technology that I'm following, that is something that we see change here soon.
What have been the biggest growth challenges so far?
Growth challenges, I would say it can be time intensive to get the word out there when you're offering something really valuable and doing it in the right way. Because you tend, especially as a provider, to want to spend your time doing the thing that you're really good at, but you have to learn how to connect with the individuals who are good at the other things, like getting the word out there about the services that you can offer so that people know it's even an option.
I find that's good advice. I've been thinking about that in life. I remember studying as a student that I just want to keep studying the stuff I knew, but as opposed to where I should have focused on maybe areas that I wasn't as strong. And I think you're saying maybe perhaps as a business owner, there's a skill set that you have as a clinician, but maybe there's some you leaning on others who are more skilled in other areas, like business outreach, maybe, I think is what I heard.
Absolutely.
What are the biggest misconceptions patients still have about telehealth?
I think until you've experienced it and used some of the technology, I think it's hard to imagine how many things can be treated via telehealth. I have some book appointments and say, is this okay? Can I? And maybe it's just a simple skin cellulitis, like they had a fire ant bite, as happens in Florida, and they're still almost nervous, like asking for permission. So just spreading the word out there about what's possible and what we're still working on.
You run this business and you still do inpatient care, correct? You still pick up shifts and
That's true.
Yeah. Is your goal to have this in the future be your time fully invested in your business?
Yes. So I did do that for a number of years. And I recently, in the past year, went back to do some inpatient hospitalist work. So same thing. It's primary care in the hospital. Obviously, the acuity is much higher, things that surely we couldn't do with telehealth and outpatient. For me, it's a nice balance. I think both are rewarding, very immediate gratification when you help a patient feel better in the hospital and they leave within days. And it's a different experience to connect with them about different issues that aren't so acute, in the outpatient and telehealth setting. So I find it to be a nice balance for me because it's really fulfilling.
That's great. How do you see telehealth evolving over the next 3 to 5 years, especially for independent providers?
I think we'll see it go in both directions. I think it's going to expand for individual and private practices like mine, as well as for the larger systems. We're already seeing that. I think just to speak to what do I see happening, I see two parallel shifts happening. One in how care is delivered and the other in how it's experienced. From a delivery standpoint, healthcare is becoming more decentralized, but with the growing burden of chronic care and chronic diseases, I think it needs to become more continuous. So what I see is a patient might have a CT scan in the ER, then they're prescribed a medication at a transitional care clinic, and then maybe they're following up in a different state because maybe they travel for work or maybe they're moving. The care shouldn't feel fragmented, especially with the modern technology we have today.
What role will technology play in your next phase of growth regarding AI, remote monitoring, asynchronous care?
Yeah, so I think it's no secret that we've introduced a lot of technology into healthcare, but we haven't always integrated it in a way that makes life easier for patients or providers. So what I'm mindful of in the next phase is thinking about adding more tools and how those tools can work in a meaningful way. From a business perspective, I see a lot of opportunity in building models that are human-centered and scalable. Patients want the convenience, but they still need to feel understood and cared for.
Something that I've been enjoying in these conversations, I've met with technology leaders across different specialties as well as clinicians. And as much as we're all enamored by AI and it can do really cool stuff, the theme I keep hearing, which is reassuring, is that it comes down to relationships. And I think I'm hearing that too in your business, that building rapport, despite it being telehealth, still being available to your patients and creating presence, trust, and that's the way care should be. That's awesome. Any other thoughts maybe I didn't touch upon for Telehealth Care Florida? Anything else that the audience should know about the work that you do?
I think for me, health doesn't start in a clinic, and I'd like to shape how individuals experience their health in day-to-day life. So I hope they feel welcome to come to me no matter where they are in their journey. I'm happy to meet them where they are. And I think a lot can be accomplished.
You said health doesn't start in the clinic. That's a good segue. You have another project that you're working on. Can you
Yes,
tell us
so I
about it?
am. So I'm working on a company. It's called Lorie, and it focuses on that piece: wellness, mindfulness, and our day-to-day lives, and how that sets the stage to hopefully keep us out of the clinics and out of the hospitals. So maybe it sounds counterproductive to what I do in my day-to-day, but I think it's important stuff. So I'm really excited for where that goes.
Let's take a minute to dive into it. It doesn't sound counterproductive, it sounds complementary. Are we talking like functional medicine or kind of like wellness type approach to things, like day-to-day living? We go to a doctor when we're sick, but this is stuff to help you feel good. Preventative care? Tell me more.
So even different than that, I'll give you an example. I travel when I do inpatient hospitalist work, and I try to really keep myself centered because it's demanding work. And to do it best, we need to take care of ourselves as providers because these are long days. And so one thing that I've added to my day to day is journaling. And
Love
so
it.
I was carrying my journal with me, which is actually a Kindle Scribe. And I was, walking around in an outdoor venue, and I found it kind of cumbersome to hold it. And I
Mhm.
wanted a strap to hold it so I could be hands free to maybe grab a cup of coffee or chit chat. And I couldn't find one. So believe it or not, again, feeding back to mindfulness, I created this accessory strap that could hold my Kindle or an iPad, a physical journal, whatever you prefer, to make sure
Mhm.
I could have it with me to keep myself on track in those moments that I have time to do that and I'm not in the hospital. So that's one example of a design that we're starting with.
Super cool. I'm a journaler as well. I think it's a huge tool for me, kind of to take I guess, kind of like I've done it since I was a teen, late teen, and just I think I had things I couldn't go to my family with, and just heard about a movie, tried it out, and just clicked for me. And I like what you're saying, and I like that you promote it to others.
Incredible.
Give
Thank
us one
you.
more. Give us one more about something that about Lana You.
So we are very early. That's all I have for now, but more
That's
to come
okay.
hopefully soon.
Yeah. We're excited. Keep us posted. We're excited to learn more. Dr. Lorie, thank you so much for coming on our show and spending time with us and tell us about the amazing work that you do. We really appreciate it.
Thank you, Phil.
Where can our audience go to learn more about your businesses?
So telehealthcareflorida.com is the telehealth practice, and that's one word spelled out, and lonau.com.
Awesome. Thank you again. Appreciate it.
Thank
Best of luck
you.
to you in the future. Thanks for joining us for another episode of the HealthCast. Stay tuned for more. Thanks for listening to the HealthCast. If you enjoyed this episode, please like, follow, and subscribe. And share it with someone in healthcare or digital health. And if you're a healthcare leader focused on scaling your business or improving operations, I'm always open to connecting. You can find me on LinkedIn. There's a link in the show notes. Thanks so much.